Hi, just wanted to put together a little video about frozen shoulder. It's a common condition. It's also called adhesive capsulitis. The condition is characterized by a lot of restriction in the shoulder joint. So painful reaching for things. It can be characterized by like a lot of discomfort trying to wash your hair, for women trying to get your bra on. And when we say frozen, it's because there is just really limited motion in that shoulder joint. Physiologically, what's happening is that you have adhesions or restrictions that have formed inside the joint capsule. If you imagine, the shoulder is made up of a socket, like here, and then the ball on the end of your arm, and it moves like this. Encapsulating that whole joint, you have a capsule, and it's made of ligamentous tissue. So imagine like a strong Ziploc bag, maybe. So something that has some elasticity and ability to stretch. When you have adhesive capsulitis or you have a frozen shoulder, imagine that you get little wrinkles and spots in that capsule that have kind of glued together and become resistant to stretch. I was thinking about it at home. I get big plats of water for the clinic at Costco, or sometimes I get the kombucha out of the refrigerated section, and if you've gotten those things there, you know that like there's a little cardboard box with the individual bottles, and then there's that plastic wrap over the top, and they must take heat and then like melt it together to kind of entrap it in. And where that plastic gets kind of melted in, it gets kind of wrinkly and locked up and adhesed together. Same kind of idea in a shoulder that has adhesive capsulitis. That normally pliable and kind of stretchy capsule gets wrinkled up and kind of adhesed and glued together, okay? And so that is why the motion is so restricted. It's painful as you get that adhesion forming because there's a lot of inflammation going on. Truth be told, there isn't a great understanding what precipitates or exactly why people get adhesive capsulitis. It's an inflammatory condition. It tells us that there's inflammation in the body. It's often linked to overuse or repeated wear and tear. It's also, I found, linked with poor spinal biomechanics, because if you don't have good posture, then you end up recruiting and overworking those shoulder joints to compensate from a lack of motion in your neck and spine. And there's also some research that shows that it can be linked with thyroid dysfunction. So if you have a frozen shoulder, it's helpful to look backwards in the history and see if there's any of those factors going on and whether or not they're modifiable. Because if they are, they can give us information about what treatments might help you improve your mobility and get better results. Okay, the typical course of frozen shoulder or adhesive capsulitis involves the freezing up period, which is characterized by a lot of pain. It hurts. It's really uncomfortable. It's difficult to sleep at night. When you go to reach and take things out of the refrigerator, it hurts. I've had adhesive capsulitis, and there were times that I would go to use my arm and catch it the wrong way and break down in tears or yelp like a dog that was hit by a car. It hurts if you've had it. You have that freezing period, and then things just kind of stay frozen for a period of time, and then eventually they have the thawing period where they're not really so painful anymore unless you're just kind of in that very end range motion where you're getting the joint really stressed, but everything is still really locked and not super mobile. And gradually, kind of like a sunrise and a sunset, it will fade away typically. So for a lot of people, the whole progress from freezing to frozen to thawing can take about 2 years, like 2 to 3 years. And I would tell you, in my case, it's been about 2 years. I've personally done a lot of treatments. And so some of those things are helpful. They were helpful at helping me manage the discomfort during that initial freezing period. Those things can be like we talked about, improving the biomechanics of how your neck sits atop your shoulders and the mobility and strength in your back. If you have muscle imbalances where your pecs and everything are really tight and rolled in, we want to loosen those kinds of things up. So chiropractic adjustments can help. Stretching and strengthening can certainly help in the spine, in the thorax, but also in the shoulder joint itself. I think it's always great to work with a physical therapist when you have frozen shoulder in conjunction with chiropractic. Graston technique is a therapy where we use stainless steel tools to get into those muscles and break up some of those adhesions. For some people, it can be super effective at restoring range of motion and speeding up that like freezing, frozen, thawing process. Things like kinesio tape can help to decrease pain, improve motor coordination, and improve range of motion. Acupuncture, sometimes supplements can make a big difference. In my case, I even went the route of having a steroid injection. And I would tell you that reduced some of my dysfunction or pain associated with it by about 80%. In my case personally, I'm just going to share it with you because I think it helps to understand how things came on for me. It was the result of having a job where I used my shoulders a lot, all of the time. It happened at a time after I'd had a C-section, so my core strength was changed and a lot weaker. I developed some bad biomechanics as I was adjusting, so I ended up popping my shoulder a lot and jamming my shoulder joint. So there was definitely repetitive use and injury that was a factor for me. I had a baby and a toddler at the time. I was constantly lifting up his car seat and getting him in and out of cars. So there was definitely that wear tear. But for me, I wasn't getting good quality of sleep because I had a toddler. I had the stress of running a business. So all those things put me in a pro-inflammatory state that made me susceptible to having that injury. And so that's a little background on my case. Because I made modifications and did stretching, had a lot of massage therapy, got adjusted regularly, had Graston treatments, did a bunch of acupuncture, I was able to live my normal life very well. I continued to work and adjust. That also probably didn't help the duration or speed up the course. But I am a big believer in progress, not perfection. And for me, it just wasn't an option to take time off of work to let things fully heal. So the tools that I used made me much more comfortable during the process. And I would say 2 years in, my range of motion is gradually returning. I have a lot less pain associated with it, but I'm still not back to doing some of the things that I really love to do, like yoga and push-ups, things like that would really still aggravate it. So that's been the case for me. And I share that because I think it's helpful sometimes to hear other people's experience. So if you're dealing with frozen shoulder, if you're curious to see what things we have to offer you, we'd be happy to talk about it. Bye-bye.